Hello everyone, my name is Lisa Rosado. I am one of your classmates in EDU. So today I am just discussing I chose three of the questions or objectives from the module. I did choose number 2, 3, and 7. So I'll start off with number 2. It says to describe the role of adaptive behavior in the definition of intellectual disabilities. I did do some research, of course, even outside of the book as well, but I did find most of it through the book, our PowerPoints, and even just some of the other questions that we've answered thus far in the module. So it says that adaptive behavior includes social, self-help, maturational, and communicative acts that help individuals adapt to their surroundings. The most rapid and dramatic changes in adaptive behavior occur during the infancy and preschool stages, which is naturally those children are like, sponges, and, they're going to either absorb or they're not going to take to the information. In order for a child to be classified as having intellectual disabilities, that child must demonstrate deficits in adaptive behavior that are comparable to the child's IQ. And they're usually measured through observation and interviews with the child's parents, guardian, and the teacher or the teacher. I personally think and the teacher, as well as the parents should be involved in that. Just because if you're observing your child at home as the parent and then this teacher is observing your child at home as their educator, then I feel like it should be a multitask thing. So also I had answered number 3. It was to state and explain some of the learning characteristics of individuals with intellectual disabilities. I hope I read this right. It was state and explain some of the known causes of intellectual disabilities. So some of the known causes, again, I did a lot of research on this just to even inform myself because I'm unaware. So some of the causes of intellectual disabilities, one way is trauma and physical agents, which is, natural, of course, that could really be for anyone, but of course children who, were caused trauma or physical trauma that, could really disable a child. So some of those could be before, during, or after birth. An example that I read up on was hypoxia. I've never heard of that, but it is a lack of oxygen and injuries through child abuse. There was postnatal gross brain disease, which refers to tumors that occur after birth. There was metabolic and nutritional disorders. So with this disorder, the child's inability to metabolize or tolerate certain elements of food result in brain injury. Infections and intoxications, which there's some examples of rubella, meningitis, syphilis, exposure to drugs and alcohol or lead, which obviously, alcohol is probably the most common out of all of these that we've all heard of before. So fetal alcohol syndrome and drug addiction are major causes of intellectual disabilities, which again, I didn't find that to be very surprising to me. We've kind of grown up knowing that, shouldn't be drinking while you're pregnant, and so that's pretty self-explanatory. Number 7 was to describe teaching methods and materials that can be used to help students with intellectual disabilities achieve their learning potential. So obviously some teaching and materials were teaching in small groups. That's pretty obvious. Even if you have a child that isn't intellectually disabled, teaching in small groups, obviously the information is just processed so much better. Even myself, I prefer to work in a small group. When the class is so large and you have multiple people asking questions that you haven't gotten to yet because you're not at that level or you're not at that point, it just seems really natural that, working in a small group or a small setting, just kind of makes it feel a little more personable or personalized, and it just seems that a child would adapt to that better. I think anyone would really adapt to that better. Teaching one concept or skill at a time, that also just seems to be a really natural thing. Again, whether you are intellectually disabled or not, just one thing at a time. You're focusing on something, and once you realize that everyone is understanding that concept, then you can move on to the next piece. But if you're just like spitting everything out and these children can't seem to digest it all, then the lesson is at a loss. Then you haven't gotten any kind of reaction from anyone. You're not teaching anything. Tons of opportunity for practice. So I think that that's really important, again, for disability or not. I think that having practice in the classroom, homework that is practice, that the kids don't feel like, or students don't feel like, you know, oh my gosh, I'm going to be graded on this. No, it's just practice, you know, like you take it one at a time. And, you know, then as a teacher, you would be able to find, you know, where it's almost like an assessment as well. If they're practicing, you know, you're able to find out where this student is maybe having trouble with something, or where they went wrong. And so I think that that's really important too, is tons of practice. Using examples and physical guidance for correct responding. For me, I'm more of a physical learner, so I think that is, you know, it makes a good point. It's really, really important as well. I mean, me seeing something and then maybe being able to work on it myself, whether it's an object or a project or, you know, whatever. I think that is always one of the best ways to learn, unless you can learn a different way. And then also teaching useful skills that can be practiced often. I feel like that's pretty self-explanatory, and then also natural as well. I mean, no one really wants to be taught something that they're never going to use in life, or that isn't going to help them excel or understand. So I think that, you know, gearing something towards, or gearing their lesson or anything like that towards something that they can use and grow from is obviously, you know, prosperous. It helps, or it's effective. So so those were my 3 questions that I answered, as well as just having my discussion. I'm hoping that somebody answers some of the other questions, because I'm also interested in knowing. I did do some research on some of the other ones just to better inform myself. But I hope this was helpful, and thank you. I'll see you guys soon. Bye bye.